non-communicable disease contribute to majority of deaths worldwide. It was estimated that 83% of all deaths are caused due to these non-communicable diseases. How does the heart attack happen? It's not an overnight thing that happens, right? But over the days or over the years, there's damage that is accumulated in the arteries, but there is a sudden plaque rupture, and then it causes the heart disease.
So when you upload that onto the app, you initially get an AI insight, right? Of every single medical report, you get an AI insight.
Good morning, everybody. Today's podcast is so important. You, your mama, and your grandmama will better watch this because we are going to talk about something that is silently killing majority of our nation. And today to discuss this, we have a lot of special people, so please stay tuned. Today we are going to discuss about NCDs, and we are going to talk about the preventative, early identification, and effective management of this. But we are not just going to talk about problems only, what's going on and boo-hoo. We are going to bring a proper new AI-powered solution, which is going to help you get the solution and to understand what's really wrong with you and to prevent it and to be healthy, because that is our main goal. So today we have Dr. Dulanjali with us. She is a specialist in training in general medicine, and she's going to talk to us deeper about NCDs. And we also have Sudeepa, who is the community manager of Ayubo app. And you guys have to stick around because this is new mind-blowing stuff. Hi, doctor.
Hello, Sarani. How are you?
How are you this morning? You look amazing, by the way, today.
Thank you
so
for the
pretty.
beautiful introduction and all the compliments.
Let's get started, okay? I'm not going to go on. I'll ask you. Can you briefly tell us, please, what non-communicable diseases are and why have they become such a global problem?
So yeah, that's a wonderful start. So non-communicable diseases are long-standing medical conditions which are generally not transmitted from person to person. And these are like common conditions that we all know of, like heart attacks or chronic kidney diseases, diabetes, hypertension.
Cholesterol.
Yeah, all that, right? And then if you think why it's a global concern, so non-communicable disease contribute to majority of deaths worldwide, right? And then even that is more in low and middle income countries. And specifically in Sri Lanka, in 2018, it was estimated that 83% of all deaths are caused due to these non-communicable diseases.
Okay, why do you think low and middle income people suffer more with NCDs? How are the high income earners, is it awareness? Or?
So I think it's the social determinants, right? Which means that, so high income people, so they have better access to healthcare. Not in all the countries, but at least in some parts of the world. Whether there's good quality of life, they can afford better food, right? They have, better education and better jobs, opportunities and all that. So from the beginning of the life course itself, they take charge of their own health.
I feel like even the education, I feel like they kind of self-research on these things.
Exactly.
They have that awareness, whereas I take it back to our education system, not to go too deep and off topic, but even growing up, everything you study the textbook and write it on our exam, right? But I feel like foreign education systems, there's a lot of research-based education. Mm-hmm. So when it comes to your health as well, we research and we are like, why is it scratching here? And we think we're going to die, but we're not. Yeah, let's get to the second question. How do lifestyle factors, this actually goes with that point, factors like diet, stress, and sleep contribute to the risk of developing NCDs?
So as we all know, having unhealthy diet and not having exercise, having poor sleep, and chronic stress can all contribute to developing NCDs. So what basically happens is, so let's take an example, right? So if somebody is having high sugar levels, high cholesterol in their bloodstream, so ultimately what happens is they'll go and gradually cause little bit of damage every day to the blood vessels and to nerves, right? And as this damage accumulates, it'll ultimately cause organ damage as well. So for example, how does the heart attack happen? It's not an overnight thing that happens, right? But over the days or over the years, there's damage that is accumulated in the arteries, but there is a sudden plaque rupture, and then it causes the heart disease, right?
So basically an accumulation of bad habits
Exactly.
throughout a period of time.
Exactly, right?
So basically it can, lead to an NCD or maybe complications as well, health complications specifically that you can get from an NCD, right?
Yes, so complications like strokes or heart attacks are actually coming from these accumulated
Years
effects.
of bad habits, right? And have you heard, like, we hear stories of people just, they were just going about their day and they just dropped dead. Like, and we're like, okay, stroke or something. And we're like, such a shock and everything. But to see, that is why we are stressing, we are having this podcast for things to prevent things like that, preventative, right? And like early detection, why it's so important for NCDs, because it's silent. Diabetes is called a silent killer, right?
Yeah.
These things are silent, right?
Yes. So exactly, Sandy. So just to add there, if you don't
Please.
mind, it doesn't have to be silent. It's not that it's silent always. It's just that you can actually be aware of it, right? If you keep on tracking it and you maintain your health and you get the certain reports and medical advice that you need from maybe a yearly on a yearly basis,
Right.
you can really prevent them from happening, right? So from that silent killer, we can actually take it to you yourself being on top of your health.
Okay, and you
Right.
can view the stats and see, I'm
Yes.
going off. Better go for the
Exactly,
evening
that's
walk
the whole
again.
point,
Yes.
yeah.
Putting on a bit, you know what I mean?
Yeah.
All right. So then, Sudeepa, like, how does this Ayubo app help people to do that? Help people to control their health, like you just mentioned.
Right. So, good question. I guess that would be really important to specifically say. So we have, a lot of people have medical reports, right? If you don't, make sure you get at least get yourself checked at least once a year, right? Especially if you're over 35, right? You have to get yourself checked once
Not
a
me.
year. Yes. So I'll probably
Me
have to
neither.
give you a recommendation.
Getting close though.
Yeah. So with those medical reports, very simply, our app actually gives multiple features. And one of them is when you give out a medical report and you upload a medical report,
Okay.
firstly you get a AI
Lab
insight.
reports, right?
Yes, medical lab report. For example, full blood count, you have cholesterol reports, lipid profiles, kidney profiles.
Okay,
And
good.
so when you upload that onto the app, you initially get an AI insight, right? Of every single medical report, you get an AI insight. And this AI insight, very simply speaking, you can't really still leave everything to AI yet,
You
right?
can't. Yeah, you have to get, then we don't need doctors no in hospitals.
Exactly.
Don't go to
So-
hospital, just put it to ChatGPT, you're done.
Right, that's it. So this AI insight will actually be verified by a doctor, and the
Yeah.
doctor will also furthermore give an insight.
And this app is free, you guys, just to let you know. So, like,
Thanks
you
for adding
know,
on to that,
Yeah,
yes.
like, shameless plug, but
Yeah.
you know what I mean? Like, it has a qualified doctor checking your reports and verifying the AI information, right?
Yeah.
So it's not just, guys, this is free. Do you know how
And-
expensive doctor's appointments are? Okay.
Exactly, and the important thing there is that the doctor will really look at it and she'll understand all the values and all. But if I ask you something in a kidney or liver profile, have you ever understood exactly what each of those metrics mean or what they represent? No, right? So in our app itself, we have for every single metric that we do provide a metric in the lab report, right? For example, in a full blood count, you have the right number of white blood cell count.
Yes.
Right? So for that, there are 3 things that we provide, which is why it matters, why it might not be normal, and ways you can improve on it.
Oh, wow.
So yeah, so let's say you have a plethora of lab reports that you have uploaded, for example, 10 or 15, if you have them uploaded, right? You see trends in the health as well. For example, I had dengue a while back, and my platelet count is very easy to monitor it because it was going up, it was going
it
down.
has a graph that shows.
Yes,
the app
it has a graph,
So
and
that's amazing.
exactly, and we have the reference range as well, right? So if
The
your
reference
your specific values are above a reference range, you can really, you yourself can understand. Okay,
I
this is not
uploaded
good.
one of my reports, guys.
Oh
It's
no, here
red.
it comes.
Watch the next videos that I'm gonna put out with Ayubo. It's in red, so like get the point, okay?
Yeah. So
Right?
and one more point I'll have to add there is doctors. Dula would be able to help me out here with the point, but doctors really want a more holistic picture of your health when they are giving advice.
Yeah, you can't say one trait and expect them to
Yes.
just miraculously know
Exactly.
what's wrong with you.
So, when you look at the app itself, they can really understand, okay, this has happened during this time. Okay, at this time it was really high. These values, metrics were very high. blood sugar is high or, specific metrics. So,
You know,
yeah.
the more I talk with you, this is actually really impressive. Like,
Thank you.
I'm starting to realize where this is actually awesome because it's giving you can upload anything. And I think as they in future have more features adding on to the app, you can have so many things like X-rays and so many other things uploaded to the app. So actually, you will be able to get an overall a health assessment with this free app, doctor verified information. So that's amazing, Sudeepa. I just wanted to ask you, like, how does this help early identification? But I think we already answered it. You will get a full view, right? So again, Sudeepa, I just want to ask you, like, many people studying struggle with understanding these complex medical terms, right? So how does Ayubo simplify these everyday reports?
Exactly. So as I talked about before, in every single report, we have those metrics that you have in every report. For example.
Yes. You said that they show the
Yes.
the
You have-
range that is supposed to be accepted and
You
stuff.
have that as well as you have why that specific metric actually matters. For example, why is white blood cell count there in a full blood count report? Right? So why it matters, why it might not be normal,
Right.
and ways you can improve it in case you want to improve on the values to make sure it goes from red to green.
Right.
Right?
And then probably as to why it could be high in your particular case, right?
Yes. Yeah.
Interesting.
So we do provide that, holistic picture and the specific picture as well. So you can, use it and be on top of your health.
So, doctor, so many people link NCDs to older people. But is this a misconception? Like, do younger people get NCDs as well?
Of course, even young people are prone to NCDs. They are not an exception, right? So why I'm saying this is now, if you look at young people's or this current generation's lifestyle, we see that the eating habits are very different, right? So they are more prone to eat fast food, right? And there's little exercise, very sedentary
I'm also
sort
guilty
of
of, that
lifestyle.
occasional order.
Yeah. And then sometimes even stress and not having adequate sleep, smoking, and even other drug abuse, sometimes substance abuse, all that is contributing. So even they are very much vulnerable, right? And then so we have heard in social media, even like recently, so many deaths happening due to sudden heart attacks and all that in young age, right? Yes. And then so to bring an example, so if you take a 60-year-old man and a 30-year-old man, so I feel like it's more risky to get diabetes when you're 30, right? Because there is so many years ahead of you, and then you have to live all that number of years with diabetes, which means that you are more prone to get complications of diabetes, right?
And
Unlike
taking the
somebody,
diabetic pill for so long.
So
and
long,
even taking
right?
medicine and antibiotics, like
Yes.
so many things for so long.
yeah. So definitely, even younger generations should be more cautious and take care of their health better.
All right, great. Thank you so much
Yeah, so-
because it's like so serious now. Later, I will reveal me being a young person. We also like haven't escaped the genetic component of this. Like we are healthy. Even the people that are healthy, that are active, sometimes gets caught to the genetic component of
Yeah,
this. So
right.
let's get to that later.
Yes,
Yeah.
and we'll get to that later where we discuss about how you can prevent getting a complication, because it's not just an effect of one disease. Like say you have a bit of increased cholesterol, it's not just an effect of that, but then you'll see how other diseases, like if you have diabetes, then that's also adding in to that whole set of
The
risk
family
factors.
package.
Yeah, the package, right?
That's Sri
and then
Lankans love to
ultimately
have.
giving you something very serious
Yeah.
like a heart attack. So if you have like slight a bit of elevation of cholesterol, which is familial probably, you don't have to like break your head over it. But if you have other problems also, then it's a bundle, right?
Yeah, correct.
And actually, that makes me curious. Sarani, are there people that actually come to your training programs to specifically manage their NCDs or maybe, prevent getting them?
Yes, there are some clients who had gestational diabetes. That means diabetes during pregnancy, and that makes them very scared of, having diabetes after delivery, right? And there are some girls who have thyroxine issues, doctor. So then when the thyroxine is here and there, sometimes the cholesterol goes off.
Yeah.
So very young people, 28, 30, are coming with cholesterol issues who want to avoid that. Then other clients who have diabetes, and there are other clients who are within their BMI, but they have cholesterol because their parents have cholesterol.
Right.
So we do get
So
a
they
number of
mostly come
clients.
in basically, after they get diagnosed only, they mostly come in and try to mostly prevent them, right?
Yes,
Have
and
you,
the doctor says, look, you're pre-diabetic or
Right,
you have
okay.
cholesterol, but I'm not going to give you any tablets yet. The doctor says,
right, okay.
adu karagana inda.
Yes.
They don't want to, so then they come to me so we can eat, I can teach them to eat clean and exercise and to manage this before we go for
Right.
medicine.
And then, possibly reverse some of those conditions as well, if
Correct.
possible. And
Correct.
so that's a very valid point, right? So
Yes.
to make sure that you understand, fatty liver is reversible, right?
Reversible.
So to
Is
understand.
fatty liver reversible?
Yes, of
Yes,
course.
fatty
Fatty
liver
liver
is
is a
reversible.
reversible condition.
I
You can
thought- I
reverse
thought
it
it
by
was
doing
there.
exercise.
And,
if you
pre-diabetic-
have high
Know that.
cholesterol by controlling
Yes,
it.
and pre-diabetic condition as well. It's reversible, right? So, I mean, if you make sure.
PCOS is also reversible.
Okay.
Yeah.
So those conditions are reversible. So the thing is, you really have to. So that's the thing, right? That's the point. You have to always be on top of your health and not really, just go to the doctor and, get a few medical reports after you, get a pain somewhere. You have to make sure that you do it consistently so that in case you get something like this, you get it before it worsens your situation. So that it's still in the stage where it can be reversed.
Be reversed. That's why
Right.
we are doing this podcast, because people get the call, the wake up call too late, and suddenly we are losing our loved ones, right? And it's something so simple, to prevent. It's not like you got it and it's not like a death sentence. It's something that it's so easy to prevent. You just go for a little walk and all that, do a couple of tests, but we ignore this and make it such a huge thing. So I'm really thankful that you're here with us today, Sandeepa, and that Ayubo is actually introducing an app like this. It's not just you uploading your things to ChatGPT and getting information. This is doctor verified, and it's organized. And I really endorse this app, and I'm really glad that we have this. And even in future, I'm going to make a couple of videos where I show you where I upload my reports. So really excited.
And when you said that, of course, one thing came to mind. One thing that I personally, as a user of Ayubo, something I came across is when I know the damage a burger or a submarine does to my body, I'm like, the craving that I have for that also when I
Goes,
see it
yeah.
probably goes.
Yeah, that's
It
going to block
not
my
probably
artery.
goes, it goes away, right?
It goes.
So I was out with a couple of friends, and I avoid sugar, and if there's submarines or whatever to eat on the table, I make sure I'm not really craving all that now, because I know what sort of impact it will have on your health and your statistics.
The awareness and empowerment, I think. So what we are lacking here in countries like low and middle income countries is that people don't take charge of their health, right? They think that doctors are the gatekeepers and they'll take care of everything. But then that's not what's important. You have to know about your health conditions and your risks, and that is yours, not mine. So I am guiding you as to what could be done, and it's up to you to take charge of it and not let it go to something very serious.
Also, how important is early screening, and what age should people start doing regular checkups? How
Right.
often should they keep this up? These are important so that you can upload them, when to upload them on the app also.
Yeah, so that depends really, because there's no straight answer to that. So why I say that depends is, again, I'll give an example so it's easy to understand. Let's say there's somebody who's just having mild, a bit of increased high cholesterol, right? But then there is another person who's having the same level of cholesterol, the little increase of cholesterol, but then he's also having risk factors like smoking, obesity, or maybe a family history. So that cumulative effect of the risk factors is more in that individual. So when we think of the future risk, it's more risky for that person to get a complication, right? But it's not so risky for the other person, even though he's having a little bit of increased elevation of cholesterol. So that's why we always keep saying that these are not just about numbers or just one report, like, okay, I did cholesterol reports, so it's
OG.
normal. Yeah, it's not like that, right?
Yeah.
But it's so many things put together. You have to look into so many factors called risk factors, and it's not just reading a report. So when risk factors are put in together, you can make predictions into the future as to what could happen to you in the future.
Okay. So what you're saying is like there's a lot of things, right, that
Yeah.
causes one disease, but there are people who have multiple NCDs. You know how
Yes.
Sri Lankan, your uncles and aunties have, you know,
Yeah, or
diabetes,
sometimes
cholesterol,
maybe
pressure.
not NCDs, but maybe like conditions which could lead to NCDs, which are called
Okay.
risk factors,
Risk
like
factors.
obesity. Nobody really bothers about it, right?
Yeah.
Unless it's a cosmetic problem. So there's obesity, and some people smoke, and they don't really think too much into it that smoking could really affect them, right?
Okay.
But if somebody is having the combination of smoking and diabetes, that is going to be a disaster,
Disaster. Yeah.
or even
For-
smoking by itself.
So, doctor, coming on to multiple NCDs, right? So many Sri Lankans say, oh, yeah, I have the family package, diabetes, cholesterol, pressure, all of it. So, how do you manage these multiple NCDs? How does having multiple NCDs complicate the management? What's
Right.
your advice for patients who have all these things at once?
Right, yeah. So having multiple NCDs is not a crime. I mean, that's okay to have multiple NCDs.
More like a curse.
Like a curse. But what's important is to manage it very strictly from the get-going, right?
Yeah.
Because I've seen both the ends, people who have multiple NCDs and who manage it quite well. So they live very healthy up to 70s, 80s, right?
Like a good quality of life.
Yes, not just living, not just living
Suffering and
long,
living. Yeah.
but living that length with good quality.
Yeah,
Yes,
good quality.
yeah, the longevity, right? And but I have also seen people who have that whole package, but who are not managing it adequately. So, unfortunately, by the age of 50 or something, they get all the complications like the whole bundle, like chronic kidney disease, end-stage kidney failure, wounds leading to limb amputations, and then they're suffering. It's not just a suffering for them, but it's a suffering for their loved ones and the families.
I know.
So, yeah, getting to the question. So, what can be done about it? Like I said, you have to know like what you have, and then you have to know that those things put together will increase your risk in the future for a severe complication, like what I said, heart attack, stroke, right? So, those are the debilitating effects or the complications, because
Yeah.
having diabetes and having it well controlled is okay. You're not debilitated by that. But then if you get a stroke, then one side is paralyzed or something,
Yeah.
right? It affects you. So that's the most important thing. If you have those packages, then it's important to control it well so that you don't end up in a complication. And how to control it is to be aware of it and take lifestyle modifications and necessary steps, and to be compliant with the medication, and to do early screening. And more than doing early screening and having some reports, to be aware of it, what it means. How does the trend follow? What was the trend over the years, right? And put everything together in a score, for example, to assess your future predictions. Again.
Okay, so for this right now, go to your app store and download the Ayubo app now and take some screenshots of your reports and upload them and take steps right now, right, Sudeep?
Yeah, so just to come in there as well, I
Yeah,
was really
please.
happy to hear that, Dula,
Yeah, it's like take steps, guys. There's
because
a theme going
yeah.
here.
No, because she actually mentioned our goal as well.
Yeah.
So she said that you said longevity for people, and that time that they do live as healthy as possible.
Quality.
That is exactly what that is the goal of our app as well, right?
Right.
So it's lovely that
Yeah.
we connected like this
Yeah.
on that note.
It's very interesting that they have the scoring system which will identify high-risk patients, as far as I can understand. Right, so that's what needs to happen, right? Not reactive health. So currently what's happening is we treat patients reactively. So when somebody's coming with a heart attack, then yes, we treat that. When somebody's coming with diabetes, we treat that. But then more than that, to identify risks, like he said, maybe obesity, pre-diabetes, and so on, and put it in a scoring system so it can make a prediction for you. Okay, this is your 10-year risk of getting a heart attack. So you're more alert.